You're watching News at Prime. To this now, the South African Health Products Regulatory Authority says it's received a report from the Nigerian food regulatory body about the detection of high levels of a certain substance in the Benylin cough syrup. The regulator has since recalled 2 batches and is in talks with the South African manufacturer while an investigation is ongoing. Let's talk now to SAHPRA Inspectorate and Regulatory Compliance's Deon Poovan, who joins us via the virtual platform. Mr. Poovan, good evening to you and thank you for your time. Let's talk about this toxic substance that appears to have been found in the Benylin cough syrup. What is it and how harmful is it?
Thank you very much for having me here on tonight. So the batches that we are recalling, the name of the product is called Benylin pediatric syrup. And our counterparts in Nigeria, the Nigerian Medicines Regulatory Authority, found that one of the batches that was distributed to them contained high levels of a substance called diethylene glycol. Diethylene glycol is a contaminant and it can cause abdominal pain, vomiting, diarrhea, inability to pass urine, headache, altered mental state, and acute kidney injury. Now, because of this report by the Nigerian authority, SAHPRA engaged with the manufacturer of this product, which is here in South Africa, and it was decided that while the investigation is ongoing, that we would recall this batch. Now, this batch number is also linked to another batch number because they were packed from one bulk into 2 separate packed lots, which is why SAHPRA has communicated 2 batch numbers that are going to be recalled of this particular Benylin pediatric syrup.
And I think most worrying is that it is a pediatric cough syrup. It's basically for children. How harmful has it been, particularly in Nigeria, given that that is who complained and the potential legal repercussions?
Thanks for that question. So from the databases that we've looked at in our preliminary investigations, we could find no adverse events reports linked to these 2 batches. As you know, when the medicine regulatory authorities have got systems where doctors and healthcare professionals report these adverse events to the Medicines Regulatory Authority. So we don't have any complaints or adverse events recorded at the moment.
So these are 2 batches that have been recalled. What does that mean, though, going into the future? Is this particular cough mixture pulled from the shelves in Nigeria and by extension here in South Africa for, let's call it, for reasons that would be preventative?
Yes, so the Nigerian authority has already issued a public notice to their country population to say not to use this particular batch. Because we've conducted our investigation here in South Africa and linked it to another packed batch that was distributed, the manufacturer is also now going to recall both batches, and they will have to recall it from all the places that they have distributed it to on the continent.
All right. But the actual medicine itself, because I guess what I'm trying to get at is that this is a particular batch which possibly bears a barcode, a certain barcode, and so you needed to trace this using that particular barcode. It doesn't mean, though, that the entire production of this medicine, there may be something wrong in the value chain. I think that's what I'm trying to get at.
Okay. So while the investigation is ongoing, obviously if anything points to something that would be wrong with the product itself, then SAHPRA would take additional action. But for now, it's only these 2 batches that we have this report of high diethylene glycol content. The investigations by the manufacturer will also include testing of their retention samples to confirm this, and they will make the investigation wide enough to determine whether or not it's a product problem or whether it's actually just related to these 2 batches.
Yeah. And is there a particular timeline before you come back to the public to tell us what could have been the problem, and moving forward, what will the protocols be around this medicine? Perhaps it might have been a manufacturer's fault.
Yes, so the manufacturer is aware and they've been cooperating with us, and there is urgency put onto this investigation, and as soon as we know more that the public needs to know, SAHPRA, doing its job as SAHPRA, will inform the public.
All right. Thank you very much for your time. That is SAHPRA's Inspectorate and Regulatory Compliance's Deon Poovan talking to us about a specific batch that has been recalled, and so investigations are going to be conducted, and in due course the results will be made known.